Hello, I'm Dr. Peter Lewis from Hygeia, and today I'd like to talk to you about how we use GLP agonists, and particularly how I have a philosophy for using intermittent microdosing as a starting point. Now, we're finding it's very exciting, the results we're getting from patients. A lot of people are getting not only good results in terms of weight loss, but more importantly, control of hunger, and the GLP agonists are really good at reducing food noise. To get great results, you have to do things right in the background, and that includes exercise and diet. With regards to exercise, it's important that you do both some strengths and some fitness work, and that's important to preserve muscle mass because we want you to lose fat, not muscle. With regards to diet, scientifically, the Mediterranean diet is the most validated diet, and it's important that you have enough protein. In this regards, you're going to receive some protein powder sachets from OptiSlim with your kit. And it's also important to supplement with good quality proteins such as eggs, fish, or free-range red meat. Very important that we also do the other things to control hunger. First thing, a lot of people are dehydrated. You need to drink a lot of water, particularly first thing in the morning when you wake up. You'll find food more satisfying and will relieve your hunger better if you spice it up with things like peppers, curcumin, curry powder. I'm very much into data tracking. That means I use either a Fitbit or a Ring to track not only my exercise, but also my sleep, because I think a really good night's sleep is critical to burning calories during the day. The intermittent microdosing is an idea that we don't want to overdose at the start. The dose will depend on your body size, and different people metabolize the GLP agonists at a different speed. So the range is some people need an injection once every 3 days, and some people once a fortnight. You'll find your right dose by listening to your body. We don't want complete obliteration of all hunger or nausea, but also we don't want you so hungry that you can't control your eating. There's a nice space in between. For me, one of the most important things is not to overdose on the first dose. So we're going to encourage you to do a half dose at your first injection. If you use a half dose, I've never seen anyone get an adverse event. The body will adapt to it. Now, because we're using the half dose for the first few doses, you may end up at the end of the month with 1 or 2 doses left in the fridge. Don't worry about that at all. That's a good thing because it will actually keep for a year. And as the body adapts, the dose will creep up, and then you'll use those excess spare doses, maybe your 3rd or 4th month of the program. And that will make life easier if you've got a little bit of a stockpile. You don't stress out when the next dose is going to arrive. If you have any problems, feel free to contact us for a follow-up consult. I hope you enjoy the program. We're getting really good results from a lot of our patients. Thank you for your time.